Floor Amendment number 15 by Watson.
Senator Watson to explain. Floor Amendment number 15.
Thank you, Mr. President. Members, as I stated before, preventing abortions from ever being needed in the first place really can't occur without education. I filed this amendment to ensure that students are learning information supported by widely accepted scientific research and recognized as medically accurate by such federal agencies as the Centers for Disease Control and Prevention and the United States Department of Health and Human Services. It does so by requiring that sex education curricula offered in public schools be evidence-based. This amendment specifically defines evidence-based education as information verified or supported by research that's conducted in compliance with accepted scientific methods and published in peer-reviewed journals. Again, Texas has one of the highest teen birth rates in the country, and as I've pointed out, according to the CDC, the highest rate of repeat teen pregnancies. We also know that an overwhelming majority of Texans support comprehensive, evidence-based sex education in high schools. A statewide poll in February of 2013 found that 84% of registered voters in Texas agree that high school sex education classes should teach about birth control as well as abstinence. We all agree that parents should provide the moral and ethical guidance children need, but families are faced with more challenges than ever in raising healthy, responsible teens. When it comes to sex education, schools can help by giving students age-appropriate, medically accurate information about responsible pregnancy and disease prevention. This will help us reduce abortions in the state. Members, if you oppose abortion, if you want to reduce abortions, this is one of the best ways to approach that. I move adoption of Floor Amendment number 15.
Thank you, Senator Watson. Chair recognizes Senator Hager on Floor Amendment 15.
Thank you, Senator. And I think, again, we disagree on what is germane to the bill, and so I'm not going to ask about germaneness issue, but I do think that this is, even though about sex education, you talk about how that relates to abortion, and instead of asking for a germaneness and we debate that, I would just ask that we table the amendment.
The chair recognizes Senator Watson on Floor Amendment 15.
Members, I've made my argument. I believe we should find common ground on these issues. I think it's unfortunate that the abandonment of our rules and traditions have put us in a situation where we don't seek those out. I respectfully ask that you vote against the motion to table.
Thank you, Senator Watson. Members, the issue before us is the motion to table by Senator Hager, opposed by Senator Watson. The Secretary will call the roll.
Birdwell, Campbell, Corona, Davis, Duell, Duncan, Ellis, Eltife, Estes, Frazier, Garcia, Hancock, Hager, Hinojosa, Huffman, Lucio, Nelson, Nichols, Patrick, Paxton, Rodriguez, Shortner, Sulliger, Taylor, Uresti, Vandepute, Watson, West, Whitmire, and Zaffarini.
Members, there being 18 ayes and 12 nays, the motion to table is sustained. The chair lays out Floor Amendment number 16 by Senator Zaffarini. The Secretary will read the amendment.
Floor Amendment number 16 by Zaffarini.
Chair recognizes Senator Zaffarini to explain Floor Amendment 16.
Thank you, Mr. President. Mr. President and members, this is an amendment that you heard me discuss with Senator Hager when he first laid out his bill. It is my pro-life amendment that would strike every provision of House Bill 2 except for the provisions relating to prohibiting abortion after 5 months, or to use his terminology, after 20 weeks. Mr. President, I move adoption.
Thank you, Senator Zaffarini. Chair recognizes Senator Hager on Floor Amendment 16.
Thank you, Mr. President. Members, I think this pretty much strikes the entire bill almost, comes close to it, and with that, in all due respect, I'd ask that we table Floor Amendment number 16.
Chair recognizes Senator Zaffarini on Floor Amendment 16.
Thank you, Mr. President. Mr. President and members, this is a pro-life amendment that makes this a pro-life bill. It does strike the sections that relate to limiting women's access to health care. It strikes the section that would require abortion facilities to meet the standards of ambulatory surgical centers. And it strikes a section regulating doctors and their relationships with patients. It is strictly a pro-life amendment that makes this strictly a pro-life bill. And as a pro-lifer, I would vote for this bill if this amendment were adopted. Mr. President, I move adoption. And I'm asking the members to vote no against the motion to table.
Thank you, Senator. Members, you've heard the motion by Senator Zaffarini. The issue before us is the motion to table by Senator Hager, opposed by Senator Zaffarini. The Secretary will call the roll.
Birdwell, Campbell, Corona, Davis, Dool, Duncan, Ellis, Eltype, Estes, Frazier, Garcia, Hancock, Hager, Hinojosa, Huffman, Lucio, Nelson, Nichols, Patrick, Paxton, Rodriguez, Schwertner, Sulliger, Taylor, Uresti, Vandepute, Watson, West, Whitmire, Williams, and Zaffarini.
Members, there being 19 ayes and 11 nays, the motion to table is sustained. The chair lays out floor amendment number 17 by Senator Davis. The Secretary will read the amendment.
Floor amendment number 17 by Davis.
Chair recognizes Senator Davis to explain floor amendment 17. Do you have copies of?
Yes.
Thank you.
Thank you, Mr. President. Members, floor amendment number 17 is an amendment basically that recognizes a couple of things. Number one, we all received a letter from the comptroller on July the 1st, dated July the 1st, that stated that there remained a $683.1 million balance available that remained unappropriated after the end of the regular called 83rd legislative session. And members, what this amendment seeks to do is to require that we truly do get back to that amount of funding that was previously going for family planning services. We all know that in 2011, not only was the Women's Health Program gutted in order to launch an attack at Planned Parenthood, but also about $78 million was cut from our own state budget going to family planning services. As a consequence of that, 56 clinics to date in Texas have closed, 2/3 of which are not Planned Parenthood family planning clinics, and in fact, don't do anything in the arena of providing abortion services. And these family planning clinics were providing for women the ability to prevent unplanned pregnancy. And not only were they providing those services, but for the 150,000 women that lost access to their services, they lost the only health care that they had, the only well-woman yearly exams that they had, the only cancer screenings, cervical cancer and breast cancer screenings that they had. And unfortunately, although in this budget, $100 million was added to the budget for primary care services for women, only $60 million of that is going to go directly for family planning services. Not only did we not fully restore the funding that was once going to that family planning service, but we also, unfortunately, are facing a situation where they were completely shredded. The safety net for women was completely shredded. And if what we truly care about, and I think we do agree on one thing, absolutely, every person here in an orange shirt and every person here in a blue shirt agrees that we want to decrease the demand for abortion. But the only way to do that is if we make sure women have the ability to control their family planning decision-making by having the ability to go to family planning centers. In spite of the fact that some funding was restored in this session, restructuring the family planning clinics that once existed is going to take a very long time. And in fact, it's likely that we'll never get back to where we were because Planned Parenthood, which is now completely cut from any funding from the state, was providing 45% of the services to those women. What this amendment would do, members, is it would require that the provisions in this act not take effect unless and until a $40 million allocation is added to bring the funding back up to its prior level, and that the number of entities providing effective family planning service be at least equal to the number that were providing services on December 1st, 2010. What this would encourage, of course, is that before imposing these draconian measures that will remove health services from women, we restore what once existed in this state, 56 family planning clinics that were providing the only real means of reducing abortion in the state of Texas. And with that, I would move for adoption of floor amendment number 17.
Thank you, Senator. The chair recognizes Senator Hager on floor amendment number 17.
Yes, thank you, Mr. President. Thank you, Senator Davis. I believe that this amendment is making, since it's making an appropriation, that's something that we should be doing in the finance and the budget bill, and it's not appropriate for this bill. And so with that, I would ask we move to table floor amendment number 17.
Chair recognizes Senator Davis to close.
Thank you, Mr. President. Once again, I don't think anything that is in the bill that's going to be voted on tonight is actually going to reduce abortion rates in the state of Texas. It may reduce the rate of legal, safe abortion in the state of Texas. But certainly studies have demonstrated, I have something here in front of me from the World Health Organization, that researchers found that abortion is actually no lower in terms of the rate of abortion in countries where it is legal than countries where it is illegal. And in fact, what they said is that the law does not influence a woman's decision to have an abortion. If there is an unplanned pregnancy, it does not matter if the law is restrictive or liberal. And this World Health Organization report is from 2011, and it explored countries around the world and the impact of restrictive laws versus those that were permissive. The fact of the matter is that even if this bill passes today, the abortion rate in Texas is not going to decline. Maybe the reported abortion rate and the legal rate and the safe rate. The only thing that will impact a reduction in abortion services in the state of Texas is to reduce the demand. And the only way to do that is to make sure that women have the ability to control their own destinies through family planning. And with that, I would move adoption of floor amendment number 17.
Members, the issue before us is the motion to table by Senator Davis, by Senator Hager, and which is opposed by Senator Davis. The Secretary will call the row.
Birdwell, Campbell, Corona, Davis, Dool, Duncan, Ellis, Eltife, Estes, Frazier, Garcia, Hancock, Hager, Hinojosa, Huffman, Lucio, Nelson, Nichols, Patrick, Paxton, Rodriguez, Schwertner, Seliger, Taylor, Uresti, Vandepute, Watson, West, Whitmire, Williams, and Zaffarini.
There being 18 ayes and 12 nays, the motion to table is sustained. Senator Nelson, I may be confused. Didn't we put $179 million more money into women's health care this year? More money.
100 million.
100 million. I stand corrected.